As this pandemic spreads and hospitals get overwhelmed, we are hearing more harrowing stories from healthcare workers on the front lines about what they're facing. ABC's Trevor Alt, also working from home this morning, joins us with more on that. Trevor, good morning.
Well, Whit, good morning. You know, doctors and nurses are known for their ingenuity, but right now they're facing unprecedented pressure and a crush of patients. And so many of them keep telling us in order to tackle this pandemic, they're having to put themselves at risk.
As parts of the U.S. prepare for the worst of the COVID-19 pandemic this week, the country's medical workers are suiting up and going to work on the front lines.
I'm wearing my own mask that I had purchased online, and that's just to save enough PPE for everyone else.
Those drastic steps necessary to fend off a virus that's proving to be deadly for healthcare workers. Detroit nurse Lisa Ewald had been caring for COVID-19 patients only to contract the virus herself. She died just days later. Her hospital releasing a statement saying, in part, as healthcare providers on the front lines of this pandemic, we know we are not immune to its traumatic effects. But with skyrocketing case numbers and an apparent shortage of supplies of essential equipment,
I quit my job today.
Some healthcare workers like Imaris Vera say the risk has grown too great.
This isn't going to get any better. America is not prepared, and nurses are not being protected.
Vera says she loves nursing and she's looking for jobs in telehealth, but she has to protect herself and vulnerable members of her family.
I'd rather be without pay for a couple weeks and have to look for another job than possibly lose my life or my family members.
Amy DeLine, an ER nurse at Sinai Grace in Michigan, sharing the heartbreaking reality healthcare workers are facing across the nation.
We're losing a lot of patients quickly, and as a nurse and as a doctor, usually you can give yourself a couple moments to regain composure, but now you don't even have the moment to do that, because as soon as there's one death, you've got somebody else in the process of crashing, and you're running from one bed to the next without any time to really absorb what has just gone on until the end of your shift.
This morning, hospital workers who know they're at risk are getting backup. These medical workers boarded a flight from Atlanta in late March. They're now volunteering their services in New York.
The risk is a part of nursing. New York is in a greater need, and at some point other states will have the same need, if not having it right now.
Well, so far, 85,000 medical volunteers have stepped up to help here in New York, including more than 20,000 who have come in from out of state, like that last nurse we heard from, Larice Ransom. She left behind her family and her children in Birmingham, Alabama, to go where she felt she was needed most. Eva?
All right, Trevor Alt for us. Thank you so much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.